You teach a course on quality improvement skills for leaders in low resource environments, and you have a lot of experience working around the world with not as many resources as we have in Canada. And given the situation we're experiencing now with our health human resource crisis and shortage and all that is going on, what advice do you have for our leaders today? What can we do to help sustain our staff, our human resources, and plan for the future?
So great question. Very near and dear to my heart. Health human resources was my main area of research when I was 3 years ago when I was at the Institute for Clinical Evaluative Sciences. So we've got great providers, really hardworking, stressed and burned out, often feeling overworked or overburdened. What's the number one solution people will say? Well, let's hire more people. Our system is underfunded. And maybe in some places, some situations, that actually is necessary. And certainly in low-income countries where I work, if you think we have doctor and nursing shortages, you ain't seen nothing yet. I mean, they're orders and orders of magnitude worse than what we have here in Canada. So what I teach is, again, analyze the system and look for other deeper root causes of why people are stressed and do it systematically. For example, one of the tools is Ishikawa diagram. So are there processes that are driving people nuts? Is there like waste, repetitive tasks that couldn't be done? Can we completely rethink the way in which we are organizing our work? Can we eliminate those 5 times that we ask the history to a patient? Can we figure out a way so that the doctor, family doctor, 5 hours a day, I'm exaggerating a bit, well, 2 hours, that's not exaggerating, 2 hours a day, entering data and fighting with electronic medical record or other paperwork that, people who work with long-term care, they spend an enormous amount of time doing regulatory things around paperwork in order to meet regulatory requirements, which takes them away from work. So we got to really focus and identify all of these different system issues, microsystem and macro system level issues that cause all these kind of inefficiencies and drive people in the system nuts, and reorganize things so that things can move much more smoothly and efficiently. Everybody will be happier.
So it's taking more of that lean approach, the manufacturing, putting it into healthcare. And how do we utilize some of those principles? Because there are so many ways that we can make the process more efficient, as you mentioned. And do you know if this work is prioritized now? Most leaders in healthcare especially, we're firefighting one thing after the next. So how do they take the time to do this sort of work that is important, but gets pushed sometimes to the back burner?
The problem is sometimes the important work that needs to get done isn't terribly flashy, or it's difficult to explain. And then as a result, sometimes we resort to policies or approaches that are actually counterproductive. And I have a series of in my course where I start from 2012, a headline that long-term care is broken. We need more punishment, inspections, fines. And guess what? I have slides from almost every year in between then and now, which say the same thing. Well, it hasn't been working. It wasn't working, it seems, in 2012, and it's still not working. It probably wasn't working before. But it's incredibly easy to have a very simplistic explanation that somebody is bad in the system, incompetent, and we need to punish them more, inspect and punish them more in order to get better results. And that's something that I also see in health systems around the world, even ones that think, oh no, we want to do more constructive quality improvement approach, but it's very tempting and easy to kind of fall back on some of these approaches that ultimately leave people demoralized, wanting to quit, feeling no appreciation for their work, and also feeling like the underlying system issues weren't being addressed. So we need to figure out a way to make all of this better investment in managing quality something that everybody can buy into and invest in. And even though it's much more easy to just have a 10-second soundbite saying, inspect and punish will fix the problem. That's not going to work.
And what do you think? I know we don't have the solution yet, but what would you say is something that we could do now?
Let's tone down some of the negativity that's directed to our leaders, and a lot of it's political leaders, but now increasingly to our non-political leaders within the health system. And it's fair game, in fact, desirable to be pointing out and criticizing things that aren't happening that should be happening and being an advocate for things. If there's a problem that in well-designed systems, anybody has the right to spot a problem and flag it and for it to be addressed. You need to have that kind of warning system about problems in order to be a high-functioning system. I'm very worried to the extent to which we're personalizing this. I'm very worried about personal attacks on healthcare leaders that are, I think, worse than anything I've seen in my, throughout my career. I'm worried that social media can often bring out and amplify a lot of this trend that we're seeing. I'm worried that this tone causes people to lose trust, causes people to lose the fact that despite our problems, there's still a lot of good in our system, a lot of good that happens, and still a lot of good people. And when we lose trust, then that starts leading to all kinds of other problems and dysfunctions in the system. Next thing you know, you have trouble attracting the best people to try to fix it. You start getting risk-averse behavior, getting people hiding problems. And that's not an easy fix. I'm not going to pretend that I have any great solutions, but we need to figure out how to hold our leaders to account in a way that's much more constructive and solutions-oriented rather than at a personal level.